Now normally when the patient swallows, this is the soft palate. Yeah, look at the anatomy carefully. This is the soft palate, and when the patient is swallowing, the soft palate is supposed to rise up against the posterior pharyngeal wall and act like a trapdoor and prevent barium from the oropharynx to go up into the nasopharynx. Yeah, that's the nasopharynx there. This is the soft palate here. The soft palate is supposed to rise and close like a trapdoor. I'm using the word trapdoor because that is a beautiful analogy. Yeah. And in this patient, there is palatal palsy along with pharyngeal palsy, and the soft palate has not risen up, and there has been reflux of barium into the nasopharynx and from the nasopharynx into the nasal cavity, in fact. Yeah, it doesn't matter where it goes from. It can, once the moment there is nasopharyngeal reflux of contrast, you know that there is something wrong. Imagine somebody putting a scope here, down here, and he or she will find nothing and say that the endoscopy is normal. So this is one dynamic example of palatal palsy where there is reflux here. This is just the tip of the iceberg. Yeah, when you see something like this, the patient has pharyngeal palsy. This is a dynamic obstruction. That means there are neuromuscular situations here in which he is not able to control the oral and pharyngeal phase of swallowing. Yeah? Which brings us to how do you actually do the barium study? How do you actually do the barium study? The trick now is to do it properly. What do I mean by properly? You ask the patient, instruct the patients properly. You know, so many times I see in CT scan, lamba shwas lo, shwas band karo, shwas lo, shwas band karo. Try doing it yourself. It's very difficult. We don't even explain properly to the patient. We don't give him or her trial runs, and we expect the patient to hold the breath when we want and leave the breath when we want, so that you have a patient with interstitial lung disease who has nothing but breathing unsharpness on the CT scan. And you scream at the patient, "Samajhta nahi kya?"